Hi, this is a G-PACT webinar on Social Security disability. My name is Colleen Beener, and I've had gastroparesis for 15 years. I've also been a volunteer with G-PACT for 10 years. Prior to becoming a volunteer with G-PACT and getting ill, my background is in human resource management with a focus on benefits and government programs. Let's get started. Social Security pays benefits to people who cannot work because they have a medical condition that is expected to last at least 1 year or result in death. While some programs give money to people with partial or short-term disability, Social Security does not. Social Security Administration administers both the SSI and the SSDI programs. Today we're going to start with the SSDI program. There are two different earnings tests you must meet in order to qualify for disability benefits. A recent work test based on your age at the time you became disabled, and a duration of work test to show that you have worked long enough under Social Security. The first test, the recent work earnings test, is like this. In or before the calendar quarter that you turn age 24, you need to have worked at least a year and a half during the 3-year period ending with the quarter your disability began. In the quarter after you turn 24 but before you turn 31, you would have needed to work half the time between the quarter that you turned 21 and ending with the quarter when you became disabled. I know that sounds really confusing, but it's not. If you became disabled in the quarter that you turned 27, you would need 3 years of work in the 6-year period between the time you turned 21 and the quarter you became disabled. If you become disabled in the quarter after you turn age 31 or later, you would need to work 5 out of the 10-year period ending with the quarter your disability began. So if you became disabled at the age of 45, you would have had to have worked 5 out of the 10 years between 35 and 45. The duration of work earnings test is a little bit different. Your work does not have to fall within a certain period of time. This table doesn't cover all situations, but it covers the majority of them. For example, if you became disabled at the age of 50, you would need 7 total years of work. They do not have to be consecutive. You just need to have worked at least 7 years. Remember, you have to meet both the recent work and the duration of work tests in order to qualify for Social Security disability. Now there's 2 ways that you can apply. You can apply online at www.socialsecurity.gov, or you can call their 800 number, which is 1-800-772-1213, and they will set up an appointment for you to either go in and file in person or via telephone. You need to apply for disability benefits as soon as you become disabled. The initial application can take 3 to 5 months. In some of our support groups, I've seen others counsel their friends to wait because it doesn't happen for 3 to 5 months, and that's not true. You need to apply right away because this is a lengthy process, and you want to get the clock started as soon as you can. When you apply for SSDI, you need the following things: your Social Security number, your birth or baptismal certificate, the names, addresses, and telephone numbers of any physicians and healthcare facilities that treated you, the dates of those visits, the names and dosages of all medications, any medical records you have in your possession, any lab or other test results, a summary of where you worked and the type of work that you did, and a copy of your most recent W-2. Once all the information has been submitted, Social Security is going to review your application to make sure you meet their basic requirements. They're going to look at your work history to make sure you meet both the recent work and the duration of work tests. And if you meet all of their qualifications, then they will forward your application to the Disability Determination Services offices in your state. Now, this is really common that the state agency asks you to get an independent medical exam. It can also be they may also ask for a psychological exam. They will pay for the exam, and they will also pay for certain travel-related expenses. For example, if you live in a really small town and there's one gastroenterologist, they can't send you, obviously, to him for your evaluation, so they have to find someone else who participates with their program, and you may have to travel a few miles to do that. They will reimburse you mileage if you have to go out of your immediate area for a medical or psychological exam. The doctor that they send you to is not going to treat you, and they're not going to prescribe any medication. They're going to evaluate your condition, and they will submit a report to Social Security that will assist Social Security in making a decision on your claim. There's a 5-step process they use to decide at Social Security whether or not you are disabled. Are you working? If you're not working, or if your earnings are less than a certain amount, and that amount changes each year, the state agency is going to look at your medical condition. Is your medical condition severe? For the state agency to consider you to be disabled, your medical condition must severely limit your ability to do basic work activities, such as walking, sitting, or remembering for at least 1 year. Is your medical condition on the list of impairments? The state agency has a list of impairments that describes medical conditions that are considered so severe that they automatically mean you're disabled. Unfortunately, none of our conditions are on that list. However, they will look to see if your condition is as severe as one of the conditions on the list. Can you do the work you did before? They're going to look at your medical condition, and they're going to look at the type of work that you were doing before you got sick, and they're going to determine whether or not they feel you can do the work that you did before. And if you can't do the work that you did before, can you do any kind of work? So they will look at your age, your education, your past work experience, and any skills that you have to see if there's other work that you're able to do within your limitations. Once the state agency has evaluated you using the 5-step process, they'll make a decision on your application for disability, and they will notify you by mail. If you're approved, the letter will show the monthly amount of your benefit and when your benefits will begin. If you're not approved, the letter will explain why and tell you what you need to do to appeal their decision. If your claim is approved, benefits will begin on the 6th full month after the date your disability began. For example, if you are determined to be disabled as of January 15th, you would be entitled to disability benefits as of July. Since benefits are paid in the month following the month they are due, your July benefits would be paid in August. And the way Social Security calculates your payment date is based on when your birthday falls in the month. If your birthday is at the beginning of the month, you get paid on the 2nd Wednesday of each month. If your birthday is in the middle of the month, you get paid on the 3rd Wednesday of each month. And if your birthday is at the end of the month, you get paid on the 4th Wednesday of the month. So if your birthday is the 29th of the month, you would be paid your July benefits on the 4th Wednesday in August. If your claim is approved, certain members of your family may also receive benefits. They include your spouse if he or she is age 62 or older, your spouse at any age if he or she is caring for a child that's younger than 16 or disabled, your unmarried child, including your adopted child, or in some cases your stepchild or grandchild. The child has to be younger than 18 or younger than 19 if still in elementary or secondary school full-time. And your unmarried child, age 18 or older, if she or he has a disability that started before the age of 22. If your claim is approved, you'll also receive Medicare coverage automatically after you have received disabilities for 2 years. So in the previous case, if you were disabled as of January 15th, your benefits started July of that year. 2 years from that July, your Medicare coverage would begin. Medicare pays on average 80% of covered costs after certain deductibles. In some states, you can purchase a Medicare supplement plan to help pay some of your co-payments. If your claim was denied, there are 4 levels to the appeal process, and you have the right to be represented by an attorney or other person to help you with your appeal efforts. Attorneys work on a contingency basis, which means they only get paid if your claim is ultimately approved. Their fee is a percentage of your back pay up to a certain amount. You only have 60 days from the date you receive your denial letter to appeal, so you need to get your attorney on board and get your appeal filed within that 60 days. The appeal levels are, number 1, reconsideration. This is a complete review of your claim by someone who had no part in the first decision. That person will review all the evidence used to make the original decision plus any new evidence you submit. In some areas, there is no reconsideration step. Those areas include Alabama, Alaska, Colorado, Louisiana, Michigan, Missouri, New York, Pennsylvania, North and West Los Angeles, California. So if you live in one of those areas and your claim is denied, when you appeal, you will go directly to the hearing step. The second step is the hearing. If you disagree with the reconsideration decision, you may ask for a hearing. The hearing will be conducted by an administrative law judge who had no prior part in your case. It's usually held within 75 miles of your home or by video conference. In some areas, it can take up to 2 years for the hearing to be scheduled, and that seems to be fairly common these days. 2 years seems to be the time that it takes just to get scheduled for a hearing. You and your representative or your attorney will attend, and Social Security may also provide medical and/or vocational experts. It's really common to have a vocational expert there. They will look at your illness and your limitations and what you are qualified to do, and they will try to find jobs within the community that you can still do even with the limitations that you have. After the hearing, you'll receive the judge's decision in writing. If the claim is still denied, the next step is the Appeals Council. Social Security will assist you in requesting a review by the Appeals Council. They look at all requests for review, but they may deny a request if it feels the hearing decision was correct. So if they look at your case and they think that there's nothing wrong with what the judge has done, they are not going to hear your case. If they decide to review your case, it will either decide if the case goes back to the administrative law judge or whether they are going to make a new decision on it themselves. Either way, you'll receive a letter with the decision, and if the claim is still denied, the last step is to take the case to federal court. If you disagree with the Appeals Council decision, or if the Appeals Council decides that they're not going to review your case, you can file a lawsuit in federal court. Instructions on filing this case will be included in the denial letter sent to you from the Appeals Council. If you're approved for Social Security disability, they're going to review your medical condition from time to time to make sure that you are still disabled. Generally, if your health is not improved, or if your disability keeps you from working, you will continue to receive benefits. The frequency of reviews depends on the nature and severity of your medical condition and whether or not it is expected to improve. If improvement is expected, your first review generally will be 6 to 18 months after the date you became disabled. If improvement is possible but cannot be predicted, your case will be reviewed about once every 3 years, and if improvement is not expected, your case will be reviewed once every 7 years. Social Security will send a letter to you when they are going to review your case. If, after the review, your claim is terminated, you have the option to appeal using the same appeal options listed earlier. Generally, benefits are only stopped if your medical condition has improved and you can work on a regular basis. After you're approved for disability payments, you may find that you're able to return part-time or temporary work. Social Security has programs to help you do that, which may continue your benefits as long as you do not earn above their earnings threshold. For more information on return to work rules and incentives, please refer to www.ssa.gov. Now we're going to talk about supplemental security income, also known as SSI. Some individuals receive a very small amount for Social Security disability, or they do not meet the minimum qualifications of recent work or duration of work. These individuals may be eligible to receive supplemental security income payments, also known as SSI. SSI is a needs-based program for people who are disabled, blind, or aged. The amount you can receive is based in part on the income available to you and your resources, which are the things that you own. Income is money you receive, such as wages, Social Security benefits, and pensions. Income also includes things such as food and shelter. If you're married, part of your spouse's income and resources will be used in determining your eligibility. If you're under 18, part of your parents' incomes and resources will be included. You may be able to get SSI if your resources are worth no more than $2,000. A couple may have resources of no more than $3,000. Social Security does not count the home you live in and the land it is on, life insurance policies with a face value of $1,500 or less, usually your car, burial plots, and up to $1,500 in burial funds for you and your spouse. You can complete a large part of the application for SSI at www.socialsecurity.gov. You can also request an appointment at the toll-free number of 1-800-772-1213. To apply for SSI, you need the following documents: your Social Security card, your birth certificate or other proof of age, information on where you live, such as your mortgage or lease and landlord name, payroll slips, bank statements, insurance policies, and other information about your income and the things you own, the names, addresses, and telephone numbers of physicians and healthcare facilities that treated you, proof of citizenship or non-citizenship status that is eligible, your checkbook or other papers that show your bank account number, because if you're approved, you must receive your payments electronically. If you disagree with the decision made on SSI benefits, you can appeal it. You use the same steps to appeal an SSI decision that you did for an SSDI decision. If you qualify for SSI, you may also be eligible for other benefits, such as the Supplemental Nutrition Assistance Program, also known as SNAP, which was previously referred to as the Food Stamp Program, Medicaid, or help paying for Medicare if you're eligible. Your assigned worker can help determine if you're eligible for any or all of these programs. The information in this webinar was taken from the Social Security website. While we feel it is accurate, all information discussed herein should be verified with the Social Security Administration. That ends the webinar on Social Security disability. If you have any questions, please feel free to send them to contact@gpact.org, and we will get back to you as soon as we can. Thank you.